No? Okay. We'll talk about non-insulated fractional microneedle radiofrequency secret for scars and photoaging treatment. What is fractional microneedle radiofrequency? We have to define the different words. Radiofrequency is an electromagnetic wave permitting the movement of the molecule in order to have heat generation. Fractional is the process to leave skin LC intervals that increase tolerance. And intradermal is because we are using microneedles that go through the dermis. There are a lot of radiofrequencies. We have external radiofrequencies in the aim of have minimal warming of the skin. Superficial ablative radiofrequency and intradermal microneedle radiofrequency. Intraneedle microneedle radiofrequency can be insulated in order to have deep warming. And the aim of our presentation, it is about non-insulated microneedle radiofrequency with homogeneous dermal, subdermal heating. You can see it here. The first description of use of microneedle radiofrequency was made by Antash. It's an American publication, but the technique has mainly been developed by Korean and Israelian. You can see here the thermal effect and the histologic effect. The comparison is, can be made with fractional laser. The fractional microneedle radiofrequency have a depth and flexible LC accuracy. It's almost no temperature gradient. We have greater depth of treatment with deep fibroblast stimulation. With the use of microneedle, we have microscopic crusts. It's a microfractional procedure. And we have the absence of ablative effect with short downtime and the ability to treat every skin type and almost dark skin type. So our study was a prospective study in order to study tolerance, efficacy and satisfaction of patients with scars and photoaging. It was a post-commercial study. Patient paid for their treatment. It was combined with histologic and immunohistochemical analysis of biopsy carried out 15 days and 6 months after test treatment, comparing CO2 fractional laser and fractional radiofrequency. So the procedure was very simple. Before, we have to use contact anesthesia and antiseptic treatment, and after, an healing cream, Cicabio from Bioderma France. The dispositif was the secret device. It was a Korean device sold by Iluda. The treatment parameters was the energy set to 60%. The depth was set as a function of dermal thickness. It was almost between 1 and 2.5 millimeters, depending on the area treated, and the other parameters were proportional to the depth. So we included 20 patients, 5 acne scars, 9 atrophic scars, 1 burst scars, and 5 photoaging. The mean number of sessions was under 2, and 7 patients exhibited a dark phototype higher than 3. During treatment, the main pain was 5 on a 10 scale score. Immediately after the treatment, micropapullae were observed. You can see it there, revealing the thermal effect of the microneedle. And in some patients, we have spot bleeding. Every side effect resolved in less than 30 minutes. Subsequent effects were erythema in 12 patients that disappear in less than 3 days, scabs in less than 50% of the patients that disappeared in less than 3 days also, and edema that was observed in 9 patients under 50% of the case, and that disappeared in under 2 days. No complications like infection, scarring, or pigmentary disorder were reported. The mean efficacy was 62% by physician and 58% by the patients. It was a good concordance between physician and patient evaluation. The patient satisfaction scored at 7 on a 10 scale score. Here you can see the effect on enlarged port and little scars. Here the pore and the scars before and after treatment. It was the patient after the procedure, little side effects. Here on acne scars, it was acne scars resistant to CO2 fractional laser treatment. You can see it before and after. Other acne scars with the side effect here just after the session. The main effect was seen in post-steroid atrophy here before and after. This atrophy was made 3 months ago. And here the effect on the surgical scars after 3 sessions. Here on photoaging, on periorbital retids and nasogenial fold. Here on periorbital area. We also compared secret device with CO2 fractional laser in histology. The parameters were standard parameters for CO2 and 3.5 depths for secrets. We had 2 samples at 15 days for the evaluation of the inflammation and fibroblast stimulation, and at 6 months for the evaluation of dermal remodeling. At 15 days, the immunostaining shows a deepest inflammation. It's a CD3 immunostaining. Here with the secret device, with the radiofrequency device, and here with the CO2 fractional laser. The inflammation cells are in brown. Here is a Vimentin immunostaining that shows fibroblasts in brown. You can see that the fibroblasts are more numerous and deepest with the secret procedure than with the fractional laser procedure. And here is the 6 months evaluation in Orsein coloration. You can see the dermal remodeling after secret device, with disappearance of the fibrosis and the red elastic fibers that are more numerous and more evenly distributed. And here, with the CO2 fractional laser, no changes and persistence of the fibrosis. The clinical evaluation shows with CO2 fractional laser only a scar retraction with non-insulated microneedle fractional radiofrequency. We can have an amelioration of the texture of the burn scars. It was on a leg. So how device is safe and effective for the treatment of scar and photoaging? It was a high patient satisfaction in this post-commercial evaluation. Patients paid for their treatment, so it's not a satisfaction for free treatment. And we have better tissular answer than CO2 fractional laser, but the 2 techniques are probably complementary. Thank you.